So we're really delighted to have Professor Richard Sullivan with us today. So Professor Richard is a professor of cancer and global health at King's College London, and he is the director of the Institute of Cancer Policy and co-director of the Conflict and Health Research Group at the college. So he is an NCD advisor to the WHO and a civil military advisor to Save the Children. He is principal investigator on research programs ranging from automated radiotherapy planning for low resource settings to use of augmented virtual reality for cancer surgery through to political economy to build affordable, equitable cancer control plans. So Richard has led 5 Lancet Oncology Commissions and worked on 4 others in complex settings. His research teams, and he is a principal investigator for large programs like the Research for Health and Conflict in the Middle East program, as well as studies of the basic package of health services in Afghanistan, civil military cooperation in health security, polio eradication and security in Pakistan, and many others. And only recently in King's College London, we were granted an award, which Richard Sullivan, he is the principal investigator of this. It's called Research for Health System Strengthening in Northern Syria. And this award specifically looks at research to strengthen the capacity of the health system in Northern Syria. So welcome, Richard, and the floor of yours is yours to have a keynote speech, please.
Karim, thank you so much for that very generous welcome and introduction. And ladies and gentlemen, I'm absolutely delighted to be here. And first of all, thank you for an absolutely fascinating day so far. And so many fabulous talks. I could just reflect on those for the next 15 minutes. But actually, Karim's asked me to particularly sort of give my thoughts and sort of ideas around conflict in the 21st century in the context of health systems. And I hope, Karim, you can see and everybody can see these slides. Perfect.
Yes, we can.
Lovely. So I've got about 10 slides to go through what is a huge topic. I'm not going to really reflect much on Syria because that's the nature of the conference. Really what I want to do is perhaps situate everything you've been hearing today in a sort of wider exposition about conflict and health in the 21st century. Before I do that, I thought it's just worth quickly mentioning about the home. And Karim mentioned the Research for Health in Conflict program that was granted to us about 3 years ago. We're very lucky. We've got a very collaborative, pan-disciplinary, pan-faculty under the Conflict and Health Group, which spans across the NHS and our university partners. And I think most importantly as well is we have fantastic relationships like USOM, like the Syrian Public Health Network, that really makes sure the scholarship that's conducted at King's and with our partners really is relevant to contemporary issues around conflict and health in the modern world. So that's just a little bit about the Conflict and Health Research Group. What's the foreground? Well, I want to start really by giving you some historical contingency. It's hard to understand what is happening now in conflict and health without understanding how current policy makers really, if you like, were inaugurated in sort of crucibles of fire. The optimism, I think, after the end of the Cold War in 1987 really soon gave way to a lot of disappointment, as what we saw was multiple wars breaking out around the world, from the huge Yugoslavian wars across to the bloodshed of Rwanda, Somalia, and West Africa. And really a lot of us sort of growing up in the 1990s were faced with this kind of idea that humanitarianism and development had really failed. And it's really fair to say there was a really negative neo-Malthusian view of the world. Things started to get slightly better, but of course in 2001, it changed completely and irrevocably again. And what we saw then again was health and development being increasingly securitized, and particularly with the advent of the wars in Iraq and then Afghanistan, development aid and security being tied to security objectives. So for these 20 years preceding what we're seeing now with the Syrian conflict and the impact of the Syrian conflict, nearly all the policymakers really grew up in these 2 big eras and these sorts of environments. I suppose in the last 10 years, we've seen 2 things happening. Really, the rise of what Colin McInnes called the spectator sport conflicts. And I'll explain a little bit more about what I mean about that in a moment. And I think it's germane in the sense to the way that the Syrian conflict and conflict in health is now seen. And we've also seen the superimposition of complex emergencies, particularly those involving infectious diseases. A lot of people have made a lot of commentary about this already in the last few years in the scholastic community, which is that we really are seeing incredible post-Westphalian complexity. So conflicts breaking out and then spreading across borders and interfacing with various actors and events that really defy any sort of explanation, what I mean predictive explanation or forecasting. A lot of these are very complex adaptive systems involving both state and non-state armed actors, variety of issues like climate change, for instance, influencing the way these things happen. And that includes the transmission and transition of health in these particular areas. So we've seen a real rise in complexity when it comes to conflict and health. The other thing has been as well the weaponization of healthcare, and people like Fuad and colleagues have articulated this very well. This is essentially, I think, probably one of the greatest crimes of the 21st century. Beyond genocide now, we are now seeing the fact that health is no longer sacrosanct, that it is a target both for weapons and also a target for weaponization. And indeed, when you read the Spectator Sport War book, it's quite clear that one of the problems in the West is the fact that for the majority of the public in the West, war is a very distant thing. For many people listening today on this Syrian conflict, war is ever present. You've experienced it, you've been there. For most of the West and the policymakers, this is very distant. This is only watched through the prism of CNN, through Sky, through the media. So the experiential nature of war in contemporary societies simply is not there anymore. We see it entirely through the prism of medias, and that alters the way we interface with conflicts. It also alters the way we see health within the frame of context of conflicts as well. A little bit more really about the superimposition of complex emergencies. It goes without saying that Ebola probably before COVID-19 was the biggest thing. I mean, we saw in post-conflict settings in West Africa, the impact of the Ebola epidemic in the first wave. And then most recently in the Democratic Republic in Congo, particularly in the Kivus, which have been subject to decades and decades of complex multi-party warfare. And this is, I recommend this paper to you in the New England Journal of Medicine if you haven't already read it. It's very illuminating. But it's worth remembering as well that Ebola is not the only threat. We've seen numerous other epidemics and pandemics over the last decade. It's again worth reminding that one of the reasons we've not seen the eradication of polio is still because of the conflict situations in which polio resurges. So when we think about complex emergencies at the moment and policymakers within the conflict and health area, we need to think of conflict and pandemics in the same breath. And it's not to say that NCDs aren't important, it's that is where the majority of the focus has been. And certainly now with the COVID-19 pandemic, that will be the refocus, I guess, over the next decade, quite easily. But just to remind everyone, of course, again, this is a backdrop of old enemies within conflict and health as well. We still have the old problems of explosive and toxic remnants of war. And of course, those plus other factors lead to other major health threats. This is marvelous articles just come out in the Journal of Infection by Aula, Abbara and colleagues looking at the high rates of AMR in clinical isolates from laboratories in Syria. And I think within the sort of context of COVID-19, it's very easy to get distracted away from those continual and growing other problems underneath. At the end of the day, at some point, we will have control of COVID-19, but AMR will continue to be a major threat and a growing threat within conflict and health environments. So where does that leave us really beyond the pandemic? And as I said, at some point with vaccines and with better control measures, the pandemic will reach a global equilibrium. I think the first thing to say is, I think from a scholastic viewpoint, one of these things is we're seeing huge socio-demographic and health transitions around the world, and particularly in the rate of urbanization. Estimates are probably around 3/4 of the world's population by 2050 will live in an urban or peri-urban environment. So urban conflict and urban warfare, in a sense, will be the next big ecosystem issue. It is already, but that will continue to grow. people like Ghassan Abu Sitter and Nassim Al-Achi have done some fabulous work on this idea of changing therapeutic geographies, that our whole idea about health systems, which are built on these very Westphalian Western models, simply no longer apply, because people migrate around, they move across national borders, they move within their country. That could be because they're IDPs or they're forced migrants, but it may be simply care seeking across very, very different therapeutic geographies. And understanding the ecology of war and conflict and what this means in these contemporary conflicts is essential. And it means ditching the old ways of thinking about health systems, strengthening as well, in my view. And finally, really, the nature and parties in armed conflict are changing. It is hard to ignore the changes in military doctrine. It is hard to ignore the changing use of weapons. Old operational approaches, for instance, deception warfare, what the Russians called maskarovka, have been reactivated. This makes attribution of who's doing what in warfare, and also the application of norms within health. For example, the Geneva Convention, very, very difficult if people are going to prosecute that sort of thing. We're seeing cyber biowarfare as well. So, for example, the bombings in Yemen's targeting water facilities around outbreaks of cholera can be seen as an indirect form of biological warfare. That has become normalized in the way that operational doctrines have been driven now. And that's something, again, that has enormous impact on health into the future. And finally, the sort of nature and the parties in armed conflict, the rise of non-state armed groups and the use of those who are engaged in proxy warfare makes it much, much harder to impose normative conducts as well. And despite some excellent work by the ICRC on the roots of restraint in warfare around non-state armed groups, I think this is going to be a huge challenge for the sort of conflict and health ecosystems generally over the next decade. And finally, last slide, and I pull this really from Ghassan Abu Sitter's fabulous work on knowledge subjugation, and also on the work that people like Rita Jackaman has done around reframing of public health in wartime, which is, again, we see a lot of conflict in health through the prism of Western models. So the biomedical classical model, the health system and strengthening models of the West. And that is entirely wrong. And there needs to be new forms and concepts in which this work is done, and it needs to be led by those people actually who are experiencing this in order to change policy in the future. And I guess this sort of tees up the panel in a way. My question really is, how on earth do we overcome the knowledge subjugation with what we already know? And how do we alter the research ecosystem in order to provide that sort of evidence to change practice and inform policy? So at that, I'm just simply going to say thank you all very, very much for listening to me today over these few minutes, particularly to our Syrian friends and to all our wonderful partners in the Middle East, particularly the Research for Health in Conflict program. It's been wonderful and a great honor to work with you over these years. Thank you very much indeed, Karim.
Thank you. Thank you very much, Professor Richard, for these insights and for these kind of framing for really the key priorities areas for health research in conflict settings, and especially in the Syrian context. I think there's a lot to do. After 10 years of conflict, there's a lot to do in the field of health research. And that's what we will explore in the next panel discussion. So we're pleased to be joined by 5 different distinctive speakers. And we try to have this panel discussion to be representative of different type of actors who might or who are involved in research in Syria. So let me introduce my panel speakers. So we have first Dr. Preeti Patel. Dr. Preeti, she is a reader in global health and conflict in the Department of War Studies here at King's. She is also the co-principal investigator for the Research for Health in Conflict in the Middle East program. So she's very familiar with health research in conflict settings, specifically in the Middle East region. And also she is the co-director of the Conflict and Health Research Group, which co-hosts this conference. So she published extensively on issues related to health in conflict settings. Also she is an investigator in our upcoming Research for Health System Strengthening project at King's. So welcome, Dr. Preeti. And we have Dr. Zedoun Al-Zoubi. Dr. Zedoun Al-Zoubi is best known to be the CEO, who was the CEO for the USM, for the Union of Medical and Relief Organizations, until August last year throughout the country. But he's still committed to support the Syrian civil society. He's a consultant with various organizations and NGOs in Syria and internationally. He published on the health governance, especially in northwest of Syria. So he's one of the first who published on this dynamic topic. And a part of his engagement, he took the responsibility to facilitate several initiatives for the Syrian civil society, engaging with UN agencies and other NGOs. He holds a PhD degree in management received from the Arab Academy for Finance and Banking Service. And then we have Dr. Aula Abbara. Dr. Aula Abbara, she's a consultant in infectious diseases at the Imperial College NHS Trust here in the UK. And she's an honorary clinical senior lecturer at Imperial College. She teaches and supervises students on global health. She was involved in various projects related to Syria. She volunteered with the SAMS, with the Syrian American Medical Society. She volunteered in Greece. She did research related to, for example, AMR, TB, and others. We have Dr. Munzer Khalil. So now we moved toward the field from inside Syria. So we have Dr. Munzer Khalil. Dr. Munzer Khalil, he was the health director of Idlib Health Directorate from 2013 until only 2 months ago. So he worked as an orthopedist for inside Syria and a manager of many field hospitals between 2011 and 2015. And Dr. Munzer worked extensively to establish local coordination mechanisms in northwest of Syria until they were able to establish the first health directorate in the rebel held areas in northwest of Syria. Only recently, Dr. Munzer came to the UK to study a master in health policy and planning at London School of Academic Medicine and London School of Economics. And lastly, we have Dr. Ciwan Mistefa, and we are very delighted to have Dr. Ciwan from northeast of Syria. Dr. Ciwan, he is a medical doctor from northeast of Syria. He's been involved in the health response in northeast since the start of the conflict. Again, he contributed to the establishment of several local coordination mechanisms and body in this region. And currently, he holds the position of the health director of northeast Syria under the self-administration. So thank you very much, our panelists, for joining us today. I will start by a question. I would like maybe Dr. Preeti and Dr. Aula and Zedoun to comment on this question, and then I will turn to Dr. Munzer and Dr. Ciwan to see the kind of the field perspective. So the first question, which is really simple. So what do you think the importance of health research specifically in this point, in this phase of the Syrian conflict? And what are the potentials of health research, if there is any? So let's start by Dr. Preeti Patel, please. Let's start by Dr. Aula while Dr. Preeti joins us. Dr. Aula, please.
There we go. Thank you very much, Karim, and many congratulations on such a wonderfully organised conference today. So the importance of research in terms of health in Syria is relating to a number of things. So the Syrian conflict has been going on for almost a decade now. And as early as 2013, some of my colleagues like Dr. Coutts and Dr. Fouad had been saying actually there's a dearth of data in terms of health, both pre-conflict and at that time in the conflict across Syria to help us understand what the key health indicators are, but also what key interventions that are relevant to different parts in Syria are. And I'm very sad to say that now in 2020, it's still very apparent. So listening to the different presentations today, I can see for a lot of different things, whether it's maternal health, vaccines, non-communicable diseases, we still don't have the right level of data both in terms of descriptive data, but also qualitative, and also in terms of the interventions that are going to be effective inside Syria. So I think that's a key point in terms of why research for health in Syria is so important.
Thank you, Aula. And now maybe I will turn to Dr. Zedoun, maybe linking the same question, but linking this to the current phase of the Syrian conflict even more.
Thanks, Kareem, and thanks everyone, and thanks for this nice real event. I think the importance of this research is twofold. One, that is possibly a pure coincidence, and the other is just the real Syrian context. Let me start with the second one. At the moment, we're talking about a Syrian conflict that is going down as the heat of the war is just hopefully stays like this. And now we are waking up to the reality that there is no health system in the country. The health system is collapsed. And I'm not talking about Northwest. I'm talking about the entire country. There is no health system in Northwest, Northeast, in government-held areas. Maybe one would say that there is no health system is a bit of exaggeration. But those who have first-hand information from inside the country, whether we're talking about East, Northwest, or government-led areas, the health system is collapsed. Khalas. You don't have health professionals, or most have migrated. Infrastructure is fully destroyed. Diseases everywhere. Just look at the response in the governmental areas towards COVID-19. In that case, we need a lot of information to have efficiency and effectiveness in our response. We need to rely on information, knowledge, expertise directly extracted, directly implemented in order to respond to this unbelievable crisis. Number one. Number two is that this research and this partnership as a whole comes at a really critical moment in the world's history, possibly, which is COVID-19. And it tells you the lesson that we have always spoken about. And we said, well, the word is connected, the word is one village. I think we all read that lesson nicely. Very few understood that lesson carefully. Now, this lesson is just demonstrating itself. Listen, the word is connected and threats are connected. Everyone, disease are connected. Everything is connected. So if we think that we're living in comfort zone here or there in the world, we have to understand that our responsibility is our response everywhere, because it's not only those who believe in partnerships should stand for that. Even those who did not believe in that should understand that this is a moment where we have to defend ourselves wherever we are. And the knowledge that is extracted in Venezuela would be very much helpful in India, and the knowledge that is extracted in UK will be implemented in Syria and vice versa. So this is a critical moment that I think that we should always seize and turn this threat into an opportunity. And I'm sorry I spoke for long.
Thank you very much. And that's what we know about you, Dr. Zedoun, that you speak, directly and honestly about the situation. So now maybe linking the same question with Dr. Preeti Patel about not only Syria, but complex settings in general, the importance of health research and how this is reflected into the Syrian conflict.
Okay, thank you, Kareem, and I'm really sorry about my Wi-Fi and data. I'm stuck in Kenya in a really not a very great area, so apologies for that. So just to offer some reflections of what we've learned over the last few years in trying to strengthen this research capacity in difficult areas. First of all, I think most of the funding that's available has gone to countries that you may call fragile, but they're not the same as Syria. They're not in active conflict. So research is always going to be a challenge in places that are incredibly difficult security environments. And actually most of the funding, if you look at it through most of the major schemes, has actually gone into countries which are receiving refugees rather than places that have large IDP populations and other conflict-affected populations. Secondly, I think the point is that the research landscape itself has changed quite considerably over the past 5 years. So there's far more opportunities than there were sort of before this period. And this reflects kind of global commitments to the Sustainable Development Goals. The UK has, I think, been a leading light in terms of the funding allocations for this, and it might not be a leading light on many other areas, but it certainly has been in terms of trying to develop partnerships. And I think the key point around these partnerships is that they take a really long time. It takes a long time for us to know who are the kind of partners that you should be working with in order to gain access to very difficult areas. We've had long-standing collaborations in other parts of the world and have learned quite considerable things about partnerships. And I won't go on too much about partnerships because you could probably have a conference entirely about the types of partnerships and what you need to do proper research in these settings. But I'm going to end with some challenges around research in difficult areas. And I think the mentoring one has been mentioned quite a lot today. And I see it as an opportunity, but there's often complaints around authorship and around, so many issues to do with career development, that there's quite a lot of people at the early career level, but very few go to the mid level and the sort of the higher levels. And this is particularly so for women. And I know Kristen's been presenting quite a lot on this area and going to sort of do a work stream on this. And then there's this issue about the actual funders and the language and the reporting requirements, which are really quite overwhelming. And I think if there's any funder that's listening to this presentation, it's a real kind of request to try and reduce and to reform some of the language requirements that, can really take up far too much time to the detriment of actually conducting research itself and building and strengthening capacity. And the last point I really want to make is about ethical approvals. I know there's quite a lot of presentations today which talked about getting ethics from the ministries and the universities. But if we're going to have NGOs who are the main implementers in these areas, we need to sort of think about having IRBs in these organizations, developing them from scratch if they're needed, and then strengthening them. So we do have an ethics workshop which will be open to everyone, which will be organized by the American University of Beirut, one of our key partners, in the next few months, which will be again on Zoom with all the sort of challenges that encompasses. So back to you, Karim.
So thank you, Dr. Preeti, for these insights and highlighting these challenging environments where research could be very challenging in complex settings. And now we will turn to more the field. So we have Dr. Munzer Khalil with us. Dr. Munzer, if you can please just summarize first your take about the importance of health research context, especially in this period, and also how research in general are being done or have been done in the Syrian context in the last few years, and how we can form better research partnerships in this regard.
Thank you very much to give me this opportunity to explain a little bit about the general situation in northwest Syria and especially in Idlib governorate. First of all, I want to give you kind of historical background about the health system in Syria, especially after 2011. As you know, the health sectors was destroyed totally. And as well as the health system, and the medical staff in that time started their work to rebuilding the health facilities and the health system. And I remember literally actually when we started our work in 2011 and 2012, in that time really we didn't have good internet or laptops or any tools to access to the knowledge in research centers or universities around the world, and the security situation in that time didn't allow to us actually to think a lot about research or studies. After that, in 2012 and 2013, when NGOs and donors started their work in this area, actually they brought with them their funds as well as their plans and their experiences from different contexts around the world. So actually, and till now, we don't know if this type of intervention was the best way to improve the health services or the quality of life in this area, or maybe we have another choices, better choices. And actually, I want to give some examples about this. We now in Northwest Syria have a great number of community health workers, and I guess the number of community health workers may be equal to 30-35% from the total number of medical staff in Northwest Syria. But to be honest, till now we don't have. So we speak here about a great investment in human and financial resource, but till now we don't know exactly the benefit of this project. I don't say that this project is not important or not useful to our context, but it is a new intervention because, as you know, before 2011, we didn't have this type of intervention, but we don't have any research or study about the benefit and advantages of this type of intervention. And actually, another point, when we started our response to corona pandemic in March, actually, in this year, there was like task force under the umbrella of health cluster, and Health Directorate was part of this task force. And our preparedness and response plan has many problems. There was no mention at all to the importance of providing masks for the people for free. And I guess the problem here that anybody will write plan to respond to corona in any country around the world, maybe they will not think that this point it is very important, because you can easily in any country actually go to the market and buy your mask. But in our context, there is no mask in market, and the people don't have money to buy masks. So what I say actually that because the lack of research and the lack of studies, and we can actually we can't go to the donors or UN or any another NGOs to tell them that this is our gaps and this is our solutions, and we need this type of intervention. So they just implement their experience from Pakistan, from Afghanistan, from South Africa, from different contexts. And in Syria, even before 2011, by the way, we don't have research environment. Our universities in general just do copy-paste to the knowledge and research around the world. So we as Syrian doctors and as students, Syrian students, we don't have a lot of experience about the importance of research and about the process of research. And here, this is very, I want to mention two very important project, which is the research for health systems strengthening in northern Syria, which is led by Awesome and King's College and many other NGOs and the health service provider inside Syria and some health authority. It is very important actually to improve the research environment in general, and I hope it will reflect positively on the health system in general in Syria. Thank you.
Thank you very much, Dr. Munzer. And as we really need to hear about these field insights about how health actors in the field perceive the first the importance of research and also the the key priorities. For example, the effectiveness of key humanitarian interventions in Syria that you mentioned. We've been doing these interventions for years, and we really don't know if they're effective or not. So turning to northeast of Syria, we're really delighted to have Dr. Ciwan Mistefa with us today. Dr. Ciwan, so we will speak in Arabic and I will have a quick translation after his presentation. دكتور جوان، نرحب بك بهذا المؤتمر وشكرا لتلبية دعوتنا. سؤالنا لك دكتور، ما هو الواقع الصحي في مناطق شمال شرق سوريا حاليا؟ وكيف أثر على النظام الصحي هناك جائحة الكوفيد-19؟ وكيف ترى أن الأبحاث الصحية قد تسهم أو لا تسهم بدعم جهود الاستجابة الصحية هناك؟
طبعا تحياتي لك ولجميع المشاركين وشكرا على الدعوة الكريمة. الصوت واصل دكتور؟ الصوت تمام.
واصل ونسمعك، تفضل.
شكرا. دكتور، إذا بدنا نحكي عن الواقع الصحي بمناطق شمال وشرق سوريا والأزمة اللي عم تعانيها سوريا عموما، فبدنا نحكي عن الواقع الصحي أو البنية التحتية المدمرة نتيجة 9 سنوات من الحرب اللي أثر بشكل فظيع على الواقع الصحي وعلى البنية التحتية اللي كانت بالأساس هشة حتى قبل 2011 وبالتحديد في مناطق شمال وشرق سوريا. فالحرب أثر بشكل كبير على البنية التحتية. النظام الصحي اللي يتطلب بهالمرحلة هاي غير موجود حاليا. لا يوجد نظام صحي قادر على تلبية احتياجات المنطقة، قادر على تلبية احتياجات الإسعافية في المنطقة حتى. فإذا بدنا نحكي عن النظام الصحي الموجود أو على الواقع الصحي الموجود، فبدنا نحكي من جانبين، جانب النظام الصحي ومن جانب الآخر البنية التحتية الصحية. فالنظام الصحي حاليا بعد مرور 9 سنوات من الأزمة وحرب أهلية مدمرة لأغلب مناطق سوريا ومن ضمنها شمال وشرق سوريا، نظام صحي مدمر، غير موجود نظام صحي، فقط هي حالة إسعافية لدرء المخاطر ولسد الطريق أمام كوارث بشرية. النظام الصحي يقوم بهذه الوظيفة. البنية التحتية، الجانب الآخر البنية التحتية التي كانت كما ذكرنا كانت هشة من قبل 2011 وبعد 9 سنوات من الأزمة، البنية التحتية حاليا في عموم سوريا ومن ضمنها مناطق شمال وشرق سوريا بنية تحتية صحية مدمرة. أثر بشكل كبير السببين اللي ذكرناهم على عديد من النقاط. مثلا أدى إلى نقص كبير في الموارد البشرية اللي تحتاجها مناطق، بالتحديد مناطق شمال وشرق سوريا، إذا كان حديثنا فقط عن مناطق شمال وشرق سوريا. فالنتيجة هجرة ونزوح العشرات حتى والمئات من الكوادر البشرية الطبية من هذه المنطقة إلى خارج سوريا بالتحديد، فسبب نقص في الكوادر البشرية، زائد الواقع اللي فرض حاله من 9 سنوات حتى اليوم بخلق واقع صحي جديد وأزمة صحية جديدة نتيجة عودة انتشار بعض الأمراض وظهور أمراض جديدة في المنطقة، أثر بشكل كبير على الواقع الصحي. فمثلا كان هناك أمراض تلاشت وفقدت وانقرضت من المنطقة. بعد 9 سنوات من الأزمة نلاحظ أن هذه الأمراض بدأت بالعودة ووجودها، وارتفعت سوية هذه الأمراض كالأمراض الجلدية والأمراض النفسية وما إلى ذلك، اللي هي نتيجة الأزمة اللي حدثت في البلاد. هذا من نقطة إذا حبينا نذكرها. الأبحاث الصحية كيف تتأثر على الواقع، أو قبل ما ندخل البند هذا، كيف الواقع الصحي الحالي أثر على التصدي لفيروس كورونا أو حملة تصدي لجائحة كورونا. طبعا بهذا الواقع اللي سردنا بعض تفاصيله لا يمكن يكون في تصدي أو لا يمكن يكون الوقوف أمام جائحة كورونا. فلذلك إذا بدنا نراقب خارطة انتشار فيروس كورونا في مناطق الشمال وشرق سوريا، نرى أن هذه الخارطة تنتشر وتتسع يوما بعد يوم. وتوقعاتنا بنهاية 2020 سيكون هناك مئات الآلاف من المصابين في شمال وشرق سوريا، ووصوله إلى مرحلة أو فقدان السيطرة عليه، وبالتالي انتشاره بشكل فظيع وانهيار حتى ما تم إنجازه من إمكانيات صحية بسيطة، انهيار هذا الواقع الموجود بشكل كبير. فالأبحاث الصحية بإمكانها تخدم الواقع الصحي عن طريق بناء أو طرح رؤى لبناء نظام صحي لشمال وشرق سوريا يكون كفؤا بهذه المرحلة، ويكون قادرا على الصمود في وجه جائحة مثل جائحة كورونا. وشكرا.
شكرا لكم دكتور جوان. اسمح لي أن أترجم بشكل مختصر بعض ما تفضلت به. So I will quickly translate only the summary point of what Dr. Ciwan has mentioned already. So he started by explaining the current health status in northeast of Syria. We have two main burdens. The first one is related to morbidity in general and injuries and disabilities, and a lot of these morbidities have not been, in the area or even in Syria before the conflict. But because of the conflict, these morbidity re-emerged, and the second burden is related to the scattered and distracted health infrastructure, not only in northeast of Syria, but in the whole region, especially in northeast Syria after the attacks on ISIS. The health infrastructure was left really destroyed, and also other challenges related to human resources. So there is a lack of human resources, especially in northeast of Syria. So no human resources, and also financial and medical supplies are really scarce in northeast of Syria. And this was the case even before the conflict in northeast of Syria, because the area was not receiving, not receiving good attention in terms of building the health system. And the COVID-19 pandemic has even worsened the situation. And he expects, Dr. Ciwan, that by the end of 2020, there will be hundreds of thousands of cases in northeast Syria, and even the very weak health system currently, this health system and what have been achieved so far, this will collapse as a result of the COVID-19 pandemic. And in terms of the role of research, and I think I really like this idea from Dr. Ciwan. He said that health research can provide some insights, visions, and plans on how to strengthen the health systems in a way that this health system can tackle these life-threatening issues, and also other pandemics and other public health threats. So thank you, Dr. Ciwan, for this. And I will turn maybe to Dr. Munzer quickly, because Dr. Munzer, you mentioned about the different challenges and related to research, but in terms of research practices, so how do you think research practices were being done in Syria so far, and how this can be improved? Any specific sort of partnerships or different recommendations in terms of these practices?
Yeah, actually, I think because, as I mentioned, we don't have research in environment in general in Syria before that, and our local researcher don't have this experience. So it is very important to improve kind of link between universities, between research centers around the world, with the local people inside Syria, with the local researcher inside Syria. And what happened in the past actually was just some individual actions from some people inside Syria or outside to produce some research paper, but it is very limited, and I can't say that it is enough. So I mentioned to the importance of this kind of a project, as I mentioned, this link between King's College, also with some other NGOs and health service provider inside Syria, because as some of challenges that there is no fund inside Syria to support the studies or researchers. There is no institutions can support this type of studies. So you need the knowledge from universities and research centers, and you need the fund, and you need this partnership between all of them to produce some good quality studies. Thank you.
Thank you, Dr. Munzer. And on the point of these research practices, I will turn to Dr. Abbara. You've been involved, Dr. Aula, in many research related to not only the Syrian context, but also some other context. So, but relatively related to Syria. So what do you think are, the main, let's say, downsides of current research practices, and how we can improve these?
So I think that's a really important question. I'm going to start by saying that I'm a full-time clinician, and actually it took me a long time to engage at all with any sort of research around Syria. I was and probably still am much more interested in the delivery of healthcare, in the delivery of education in Syria and other humanitarian settings. And I think for me, part of that was, if I was an observer to a research program, and not just relating to Syria, but also many other kind of research programs and research topics, is the concern and I guess the potential for exploitation of perhaps those in those countries which may be in conflict or maybe in kind of humanitarian settings. We've seen it in the DRC, we've seen it in some interesting collaborations in East Africa, West Africa, Southeast Asia and other. And that explains some of my reluctance about getting involved in research work relating to Syria. So of course, unequal partnerships or maybe partnerships that are imposed from the setting outside of Syria. And so one thing we really need to be advocating for, and it's brilliant to see so many Syrian researchers from inside Syria presenting today, is to understand what they think are the key issues, the priority issues, and how they can be done. So people such as Dr. Munzer and others who are working day to day on the humanitarian response, for them to say, well, these are the research priorities. And also, there have been times where I've actually been amused by some of the research that wants to be done in Syria. And because I'm an infection physician, I get approached about things like, potential research opportunities around leishmaniasis or, even around antimicrobial resistance. And some of it's comical because it's completely inappropriate to that local context. And notwithstanding the fact it may be probably broadly inappropriate, but people think that if this is a conflict setting, if there is fragmentation, if the local infrastructure is weak, that they will be able to get away with doing certain research projects that we would never consider in the settings that we work in the West. Something that's very important to highlight, and I know that Kristen and others have really highlighted the role of female researchers. I think broadly, and we see it in some parts of the Middle East, in Syria, we just don't have enough female researchers for this to be clear that it's the problem quite as much as it is, but there are certainly institutions in the MENA region where younger women who may be doing the bulk of the data collection, for example, they may be research associates or research assistants, and their work is captured by high-income institutions and almost owned as theirs. And sometimes the ideas and the dialogue may either be appropriated or twisted to suit some of the thought processes or some of the agendas in those in high-income settings. And then there's a number of other challenges, and I would highlight the dearth. So with Syria, we still don't have enough research about all the things that matters. So all the obvious things. So Bayard Roberts and colleagues did an excellent systematic review around mental health care and mental health interventions. So mental health has been something that's been spoken about for some years now, but there is still no useful study. If I was in charge of a program to deliver mental health care in Syria, for me to say, look, this is a brilliant blueprint. This is what could work in this local context. And I can repeat that for everything from SRH, the sexual reproductive health, maternal health, almost every other health indicator across Syria. So it's the sheer amount that needs to be done, and also the associated costs. So something that I find very interesting is when you can do low-cost, effective research, and Maysoon Sukkari, who is at King's College, is a big advocate of this. She doesn't feel the need for a multi-million-pound grant for her to do impactful, locally driven research, which is embedded within the local communities that she might seek to do research on. And also for those of us who are working on research in Syria, for us to engage with people on the ground and to understand what they think the key priorities are, and also what is the evidence that we need to make available to the policymakers, the funders, the humanitarian organisations who are working in these contexts. So these are some of the challenges that I've noticed over the years.
Thank you, Dr. Aula. And it's really important to highlight these inequalities in research practices that sometimes are more remarkable, more visible in complex settings. And I will turn to both Dr. Zedoun and Dr. Preeti Patel. Talking about these research inequalities. So there is a comment by Dr. Adam Coates here in the chat, saying about questioning about the impact, like more research funding and partnerships. It could be, it could be channeled, but do governments actually listen to the evidence produced sometimes? So sometimes we do not have impact. So this is one fold of the question, and the other fold is really related about research interests, because sometimes we know that, some funding, and so sometimes it's not about lack of resources, but it's about the way research has been done and has been disseminated. So I would like maybe Dr. Zedoun to start commenting on these two issues, please.
Well, the short answer to Adam is no. Usually leaders do not listen to research. They do not listen to anything anyways. We have now presidents in the world who do not listen to advisors appointed by them. Well, everyone is getting that. I'm talking about Mr. Trump, for example, who really challenged science. So if they are not listening to advisors appointed by them, it is not expected that they would listen to even policy briefs, forget about researchers. But I still see now there is an opportunity that COVID-19 brought to us with all the disasters it had. Is that now we are looking at things differently, and I think this we is everyone in this world. Even leaders now, they started to think, well, we fooled ourselves for decades that we are funding health and health research in even more than sufficient manner, and I think many of them are really revising this approach, not because our lives matter. I'm not fooling myself, but because economy matters. And they saw that if they do not really spend much on health, the price in terms of economic ramifications and consequences is quite high. And I guess at least this would push them to really rethink their approach and their way to see that the health research funding, or all sorts of research. In terms of research inequalities, I want to highlight one thing, if you allow me, Kareem, please. For years, I felt like in Syria, our role as practitioners and as NGOs, our role is to collect data for researchers coming from everywhere in the world. So we need just to give interviews, collect data, and give it to them so they write research about us. And I felt like a bit, no offense, of course, I'm just, it's just like we all felt like, are we here just mice, labs? And then, of course, I'm not generalizing, and there are great initiatives such as this one, for example. But for years, there was no real sense of responsibility that we need also partners in this part of the world where we need them as with build capacity. With knowledge transfer, because this is a partnership. It's not that we are data collectors. I think this is improving a lot, and we can see now many great initiatives in Europe and North America and everywhere in the world, where they see that this is a joint effort. This is a challenge that is posed to all of us. And if you don't mind, can I just quickly also answer Brahim Masri?
Yes, please. Yeah.
Can we do longitudinal studies? Yes, I think so. But there is a big challenge in Syria. Get me stable population where I can get you really stable, easily, done longitudinal studies. The issue with us, I think, in Syria is that we have a lot of mobility and the situation is very dynamic. The environment is not stable. So you will not be able to talk to one community and you think that this community is really stable. The situation in Syria is very dynamic, changing. And this is a very huge challenge to any longitudinal studies, I guess.
Thank you, Zedoun. Thank you. Very, very insightful. And I will turn to Dr. Preeti as we're running out of time slightly. Talking about research practices, Dr. Preeti, and talking about impact, I'll ask you specifically about, different maybe research partnerships or projects that we heard of with a lot of resources maybe, but with very little impact and with very little engagement on the ground. So what do you think are the problems here and what are we missing?
I'll be very brief. I think one of the issues about impact, and particularly having an impact at the government level, is this idea of changing communication. So, people like me are very old-fashioned, still read a newspaper, but people a lot younger than me rely on social media. And if we think about government and its increasing use of social media, maybe it's social media that we have to sort of engage with a bit more in order to communicate research findings. So maybe the journals aren't the way in which they're definitely the way in which scientific outputs should be produced, but maybe the communication has to be different and the strategy has to be different. And I often think one of our vice principals at King's, Professor Fumni Olanasakin, has always sort of said, she's always proposed that actually you should think about the impact before you even think about the research. So turning it completely backwards and think, what is the problem I'm trying to solve? And then how am I going to go about doing it? And I think maybe that is something that needs to be captured a bit more effectively.
Thank you, Dr. Preeti. One very quick last question to Dr. Ciwan. I think he's still with us. Sorry, I turn to Arabic now. دكتور جوان بشكل مختصر لو سمحت كسؤال أخير، يعني تكلمت في السؤال الأول عن ضرورة الأبحاث لطرح رؤى لبناء نظام صحي كفؤ، ولكن ما هي النصائح مختصرة، لأنه ما عندنا وقت للأسف، نصائح مختصرة سواء الجامعات أو المعاهد البحثية عن كيف يقومون بهذه الأبحاث في بيئة مثل سوريا؟ دكتور جوان.
نعم سامعني دكتور؟
تمام سامعك تفضل.
طبعا بدي اختصر بشكل كبير. طبعا لتقديم اي بحث في اي منطقه معينه وقيام باي بحث في اي منطقه جغرافيه يجب ان تكون اولا هذه الابحاث وفق معايير دوليه معتمده. هذه المعايير فالمعايير تكون واضحه وبشكل مقبول من جميع النواحي. هذه الابحاث تقدم كمنهجيه وبمنهجيه لهيئه الصحه او للاداره الصحيه الموجوده في المنطقه حتى يتم الموافقه عليها ودراستها واعطاء الموافقه لاجراء هذا البحث في هذه المنطقه. العنصر الاهم في اي بحث هو تدريب العناصر المحليه لإجراء هذه الأبحاث وحتى يكون عناصر المحلية أعضاء وعناصر فعالين ضمن هذا البحث لتطوير النظام الصحي. والنقطة الأخرى طبعا شرط من شروط أي بحث أن يكون هذا البحث يحافظ على خصوصية المنطقة وخصوصية السكان الذين سيكونون ضمن هذا البحث، وهذا طبعا يعتبر من أخلاقيات إجراء أي بحث. وشكرا.
شكرا لكم دكتور جوان على مشاركتكم القيمة في هذا المؤتمر، ونتطلع أيضا للعمل معكم في إطار الأبحاث في شمال شرق سوريا. اسمح لي بالترجمة. So quick translation and summary for what Dr. Ciwan mentioned about some recommendations for health research practices in North Syria. He talked about the kind of acceptable international standards in terms of methodology, in terms of ethics and other standards. And second, about the proper coordination and to request permissions from local health authorities, because to avoid any confusion or to avoid even interferencing with inappropriate conducted research, you need to seek proper permissions, and also to collaborate and explain your methodology to the local health authorities. Thirdly, to engage local researchers, to train local researchers to do the research or part of the research themselves. They need to be involved as well in the design of these research. And lastly, about the different ethical practices related to population from one side, but also related to context specificity of these research, rather than implementing the same methodology or thinking about how these can be customized in local actors. So these are the main discussion point, but I have quick questions in the question and answers. So maybe I will ask some of our, for example, there's a question from Dr. Mohammed Atwaish, who's a dentist from. He said, from our perspective, I think we should have more engagement of Syrian researchers who are living inside Syria. We are facing many challenges due to ethical law in some research centers. This, I think, what Dr. Mohammed meant, that sometimes some research institutes would perceive involving Syrian researchers is, could breach the neutrality of research. So any comments from Dr. Aula, please, about involving Syrian researchers, and has it something to do with neutrality?
So I have to say, Dr. Mohammed makes a really important point, and it's something that we're still missing. So a lot of the researchers who are working on Syria, even those who are Syrian, maybe people who've come across, have done their Masters in Public Health and the other Masters in UK or American institutions, and they're making exceptionally valuable contributions to the field of research in Syria. We are missing that link of how we support talented young researchers such as Dr. Mohammed, in terms of gaining all the relevant skills, whether it's qualitative, quantitative, literature reviews, analysing papers, identifying and prioritising the key research topics within their communities. And I have to say, for those of us outside, we must do better. And I think to this date, we've probably failed talented young researchers who've got great potential to take this forward. There are some important discussions which have already started. The most important are the ones from SBOMS. So SBOMS is the Syrian Board of Medical Specialties, who've done a lot of excellent work around supporting postgraduate doctors in their training. And part of that is wanting each postgraduate doctor to undertake a small research project. And that might be a quality improvement project in addition, or it might be an audit project. However, there aren't enough people in external institutions who have the time and ability to invest in our colleagues who remain inside Syria. One thing beyond, I think the conversation really is beyond neutrality. I've often been told that I'm not neutral, and it doesn't stop people working with me. And that's probably a topic for discussion another time. I don't think it's a question of neutrality for working with those inside Syria. I really think it's how we provide the relevant research skills, whether it's through an MPH, whether it's through a shorter program relating to research, to equip those researchers who remain inside Syria with the skills that they need. And then failing that, we need people outside who are willing to invest the time and the dedication it takes to work very closely with a researcher inside Syria to make sure that they're able to participate and also eventually lead research projects that are important for their communities.
Thank you, Dr. Aula. Dr. Zedoun, do you have any comments, not specifically to this question, but recommendations for the research community about?
Well, just one small comment is emphasizing the spirit of this partnership that we're having right now to become a model. In this partnership, it wasn't like someone from the North Pole is bestowing their knowledge, their support to us. It was built on partnership on the basis of complementarity and the importance of really understanding and appreciating the resources we all have and the joint mission that we all have. when you defend health in Syria, it's no more you defending health in Syria. The lesson is clearly learned. When you defend population and improve their health situation in the country, you're doing that for the sake of the humanity and for the sake of yourself. This is something that we should all emphasize. There is no more I'm doing it for you. This is always we are doing it for us. Thank you.
Thank you very much, Dr. Zedoun, for these insights. And we run out of time, actually. We have a question about the involvement of nurses, but I don't think we have time now to cover it. So really, I would like to thank our panelists for these insightful comments and conversations. And also I would like to thank all our presenters. And just to explain that this conference, the idea of this conference is really to support these partnerships and initiatives. So between academic institutions, King's College London and London School of Nuclear Medicine, and also NGOs and humanitarian organizations like AWESOM and other NGOs who might be interested in health research in Syria, and also field practitioners from inside Syria. So we are very delighted that in these conferences we are receiving a lot of abstracts from researchers inside Syria, and we are keen to support them by any means. So hopefully this conference will not end now here. So hopefully this will continue with collaborations and with trying to support these researchers who presented in these conferences, but also other researchers who are interested in these equal partnerships between grassroots and local researchers, and also between humanitarian and academic institutions. So really thank you very much for your insightful presentations, all of our speakers, and also for the very important topics that have been discussed. Just to remind you that the recording of this conference will be available on our website, the R4SA, MENA, and on the new website that we'll have for the partnership with AWESOM, which is called the Research for Health System Strengthening in Northern Syria, and also on the Facebook page event. Thank you very much again, and I hope you enjoy the rest of your day. Thank you.